Okay.
Are you ready to start?
Yes.
Okay. Well, good morning, everyone. Again, thank you so much for joining our first Zoom Board of Health meeting. It's really nice to see all of your faces. I miss you all. It's great to see you. Wish I could see you in person, but it's great seeing you on video. I also want to thank the staff for joining us too. Lamont Daniels, our Chief of Community Services, and also the entire senior management team at the Health Department. First, just some logistics. I want to remind everyone that if you're not talking, if you could put yourself on mute so there's no background noise. Also, just good morning. My name's Deanna Diamore. My next thing is to state your name before you're speaking. So I'm Deanna Diamore. I'm the health director for the city of Norwalk. There may be some people who are phoning in, and so they need to know who's speaking. So just a reminder. We're going to have a public participation portion of the meeting. So if anyone from the public would like to speak, if they're on Zoom, they can raise their hand or they can *9 on their phone if they wish to speak. I'll do a roll call so that everyone knows who is here. We have Ken Lalim from the Board of Health. We have Terry Quell. We have Vince Amaruccio, Norman Weinberger, and Janet Karpiak from the board. I don't see Matt Brovender. I don't know if he's called in or not. Okay, from the city side, we have Lamont Daniels, Chief of Community Services. We have Teresa Argandesi, who's a health educator, Darlene Hoffler, Supervisor of Clinical Services, Megan DeMeglio, Project Coordinator, Tom Closter, Director of Environmental Services, Pat DePietro, our Business Manager, Glenn Iannicone, our Preparedness Coordinator, and David Reed, our Medical Director. I think I got everyone. We have a full house today. Thank you. The first item on our agenda is the approval of the March 24th, 2020 meeting minutes. If everyone's had an opportunity to look at them, if anyone wants to make a motion, any comments?
I make a motion that we accept these minutes.
Thank you, Dr. Weinberger. Do we have a second?
Terry Quell, I'll second.
Thank you, Terry. Any comments? All in favor?
Aye.
Aye.
All right, minutes pass. Great. Okay, so second item on our agenda is public participation. And I see we have 2 attendees. If you would like to speak, can you please raise your hand?
Yeah,
Larry, yep.
Yeah, we have one person with their hand raised, Diane Laricella.
Okay, great.
Go ahead, Diane.
Hello.
Okay.
Good morning. Can you hear me?
Yes, we can. Good morning, Diane.
Good morning. First of all, I wanted to say a big thank you to the health staff as well as the board. Lamont and Deanna have, I can only imagine the hours and hours of meetings and contacts related to trying to keep us safe. And as a citizen and an active citizen, I appreciate it. So I looked at the agenda and I just have 2 quick comments for your consideration. And I wholly would like to speak with some of you offline, especially Dr. Weinberger and Terry, Dr. Quell, because I want to help my city. And the first thing is the issue of messaging. People, as you know, are very tense, anxious. We're not getting a lot of help from the federal government. And I have done more research. I've been in touch with Deanna and Lamont about some of the messaging I feel would be helpful for letting the public just feel safer as they're using safety equipment such as face masks and gloves. We would never expect them to be trained. For those of you on the call that don't know me, I have about 20 years total of background in personal protection, selection, cleaning, and this had to do with my work with the hazardous materials unit of the DEP and then my work in the private sector. So one thing that I did is I went on the CDC website and I've been trying to check it almost every day and I still don't see wording in the CDC website nor from anything that the president has said about just letting the public know some of the limitations of the face masks and how to remove the face masks and the gloves in a safer, slower way. And I do think it behooves government to inform people of these additional things and let them know that they are only reducing the chance of contracting this COVID virus, not eliminating it. And I do think we can, the city of Norwalk can be a leader, even if I've been attempting to get the governor to change some of the messaging, and of course, as you know, our city. And I do appreciate what Teresa and Deanna have placed on the health website. I wanted just to say, I asked some friends just to find it. And if there's a chance, and Larry is on the call, if there's a chance that the homepage of the city website could make it easier for people to find this information, I would appreciate it. It's still not quite there, but lastly, I did submit, just for the record, and maybe Deanna can send the email to those of you. I was able to convince and get the Hearst newspapers to run an article on Sunday about some of the considerations of face masks. I'm in favor of wearing a face mask. It's just that I am feeling we still don't have enough information for the general public. So there's an article in the Sunday paper that has I think a terrific graphic from the hour. And if the city can ask the hour if they can put it on the website, but put it in a place on the homepage, not so someone has to, not everyone knows the health department has their own website, and so they may not find it. So I want to continue this quest because I still don't see enough information, even on the city website, about safe use of safety equipment. And now that we're gearing up for small businesses, a lot of the businesses are not being trained to tell their people how to wear the equipment and what kind of equipment to use. They're just giving out cloth face masks. And I just, having been a trainer in using of PPE, I just don't think it's fair to the innocent workers and citizens who wouldn't know better, and we should know better. So the second thing I just want to say, and this will be only 30 seconds, and that is you will be looking at your reaccreditation update. And Deanna, before you got on board, and even just as you were hired, I spoke about the need in our accreditation to have some consideration for it's called like a toxic legacy, or the industrial legacy of our city. We still have, and I'm in the hazardous materials field, we still have several sites that have not been cleaned up with the oversight of the state or federal government. And so I wanted to see if this year, or as we are doing reaccreditation, whether there could be a section about hazardous materials and toxic material sites, and include the issue of contractor yards and asthma adjacent to those contractor yards, especially in South Norwalk, where I now live. And again, we could work offline on this, but it's something that I have mentioned before, because while I don't expect anyone on this call to be an expert on hazardous materials and cleanups, we have access, including hiring. The city has a list of very good consulting firms they can hire to help them evaluate this. And unfortunately, I think it's fallen through the cracks. We currently have a couple of active toxic waste sites that I will talk with the health director about again. And we just want to make sure that whoever owns the site is doing their job, because the state of Connecticut has hardly any staff. And while maybe they give the final okay, if our city doesn't show an interest in the cleanup in a big way, I know we receive reports regularly, but we need to start maybe turning up the heat on the state and the federal government to help us evaluate these sites. So with that, I thank you for your service, and I appreciate having this meeting in Zoom. And lastly, I really appreciate having a public participation section. Deanna, this is the first time that this has happened in forever. So I really appreciate that as a former president of the League of Women Voters. Thank you.
Thank you so much, Diane. I really appreciate you taking the time to provide that comment to us. Okay. Next part of the agenda is the COVID-19 updates from staff and the board discussion. So again, this is Deanna Diamore, Director of Health. I'm going to just begin with giving a brief overview of where we are with the situation. And I'm going to ask everyone, Lamont Daniels, and then the health department staff to give updates from their areas. And then we'll wrap it up with some other, things about moving forward and next steps. And we want the board to please participate, ask questions, give us your feedback as we go. So the latest case counts were almost at 1,500 positive cases of COVID-19 in Norwalk, and we've had 70 residents who have died. We believe we may be past the peak. We're hopeful. We have seen that the positive cases, the hospitalizations are trending down. The governor had said yesterday it's been about a week of hospitalizations looking like they're trending down. And we are hopeful that if we continue to use these social physical distancing measures, that we can keep this trend going down. We know that we can't relax the guidelines just yet. We have to do this a very careful way. But I'm very hopeful to see that all the work that we've been doing, all of everything the community has been doing is making an impact, and we're seeing these cases going down and we're seeing the hospitalizations going down. So I always like to thank everyone for everything that they're doing, because it really is a community effort. This is a completely new virus. We haven't seen anything, we have never seen a coronavirus pandemic before, and we haven't seen a pandemic of this scale in over 100 years. And so that's why we've had to rely on these physical distancing measures in order to stay on, to slow down the spread, to lessen the cases, to reduce the hospitalizations, and ultimately to save lives. We've been meeting, I mentioned this at the last meeting, but we've been meeting several meetings with our different partners. The supervisors, we've been meeting once a day to give updates and to figure out what we need to be working on, what we need to be focusing on. Our emergency management team has been meeting once a week. We also meet with the hospital, the community health centers, AmeriCares, some, like the first responders, the school system, state, we've been meeting with state delegation. We've been just continuing to be in contact and communication as we move forward so that we can respond and adjust as we go. So it's been really great to see all the partnerships and everyone coming together to address this. I'll give some more comments, but I'd like to pass this on to everyone else to talk about specifically what they've been working on. So if we could begin with Lamont, can you give an update for community services?
Sure. Thank you, Deanna, and good morning to everyone. My name is Lamont Daniels, and I'm the Chief of Staff for Norwalk. There we go. So I want to just echo, I think Diane said it, and I just want to echo it as well. Want to thank Deanna and her power team, because they truly are the ones on the front line working with the community through the variety of ways as we continue to manage and help educate and inform our community about COVID-19, both the severity and how to protect themselves. So Deanna just asked me to share with you all some kind of larger activities that the city has been involved with under the community services. We are in constant contact with all city departments. We've had more than weekly calls to talk with one another to ensure that all city departments are working together in concert as we support our community and our department. And federal delegation to continue to seek understanding from what the federal government's perspective, our state perspective, and then what specifically that looks like and means for Norwalk. Under our department, we have weekly calls with our senior service providers. So all senior organizations meet weekly so we can understand, again, the needs, the complexities of do that similarly in Norwalk with those organizations or residential care programs. For those of you that probably have heard me over the past several weeks, we are talking a lot about food, and I think someone mentioned that on our town hall. Deanna and I participated with Mayor Rilling on the town hall on Facebook and YouTube, and someone asked, "Is the food issues real?" And my response is absolutely yes. While our pantries are working to feed and provide food to not only our most vulnerable, but what we're also seeing is individuals and families who've never had to ask for help are now seeking support and resources. So it is putting a strain on the system. And our Connecticut food delivery system, while it's happening, but the volume that once was, they're not able to meet the demand. So many of our pantries and food organization programs are in themselves actually purchasing food, but unfortunately at the market rate. Therefore, what they would normally be able to expand and pantries and actually looking flyer states and identify additional pathways to get food into our cities. So that is a big concern. And we all know, eating healthy and eating food is part of our health. And we want families to get help, especially our children. And with that said, that city, and we want to encourage and amplify that message that the schools and 3 community center local sites have food, and encourage families. If you have a child under the age of 18, whether they're in the Norwalk public school system or not, they have access to this food. And this is available online. And then lastly, I'll talk about briefly our mental health and well-being, because that is important. And many of you all know that I'm a social worker by education. So we want to ensure that through these times, we're supporting individuals and families around isolation. We know that, and we hear that from our mental health and behavioral health community, that many families and individuals are struggling around isolation. So there are a variety of warm lines. And so what is a warm line? It's a support call that whether you're a senior or a young person, and now the State Department has activated a new warm line called talkitoutconnecticut.com. That information is on our website. And so through the Community Services Department, we're ensuring and working to amplify and elevate the resources, the many resources that are available. Thank you. Thank you, Deanna.
Thank you so much, Lamont. Does anybody have any questions for Lamont? I can't tell you how grateful I am that Lamont is here now, helping us through all of this. So thank you. Next, we have our Supervisor of Clinical Services, Darlene Hoffler. Can you give an update?
Sure. Good morning, everybody. It's great to see all of the Board of Health. It's been a while, so I hope everybody's staying well. So the majority of our activity has been around case investigations and contact tracing. And initially, the health department staff was able to manage that. That was the nurses, a lab tech, and the project coordinator. But as the numbers continued to increase, we realized it was more than we could handle. So Norwalk Public Schools was kind enough to offer their furloughed nurses to assist us with that. So we now have a core of about 13 nurses to help us continue with case investigations and contact tracing and summary narratives created from the information that's collected. We also noted that we needed more Spanish interpreters. From the school nurses, we had 2 who could actually speak, Spanish interviewers, that is, 2 nurses that could do that, but that just wasn't quite enough. And then a couple of our health department staff, of course, assisted staff with collecting information from Spanish speakers. But as the numbers continued to grow, we just couldn't keep up with it, with that number of interviewers, Spanish-speaking interviewers. So we were able to enlist the assistance of Spanish-speaking ERT members to continue with that effort. It is still a struggle, but we're continuing to push through that. Recently, the DPH data dump, where they reviewed the data that was being collected and added some additional cases to the surveillance data. And so that increased our caseload significantly. And from that, we just couldn't manage it, calling everybody on that list. So what we decided was to change the way that we were going to do our follow-up and our case contacts. And that was to send out mailings to everyone instead of trying to call them all, because we just don't have the resources. So we send out case letters, case contact letters, as well as the letter for the contacts in that mailing. So the case gets information about what they should be doing, and then a letter is also in there for them to share with any of the contacts that they've had. And then there's a statement at the bottom of the letter stating that they may be contacted by a health department staff to discuss further. So what we were doing previously was just sending letters to those that we couldn't reach. If we were trying to reach them or they didn't have an address or phone number, we would send a letter. But now everybody gets a letter, and then we follow up with a call for targeted populations. And that the targeted populations that we've chosen are our senior congregate residents, people living in senior housing, as well as low-income families. Because it's important that we identify whether or not they have the resources that they need and the information that they need to stay safe and to keep transmission of infection low. So to date, we've sent out about 250 letters. That I'm sure is going to ramp up, and that's going to be a large part of our activity as well. And then we also continue to respond to calls from residents. Early on, of course, the volume of calls coming in was significant, and they were asking about, COVID as well as contacts. What is a contact? Employers and employees were calling, asking about what should be done. Should they be still working? Is the employer doing what they should be doing? So that we tried to provide them guidance on that. And now the call volume has decreased significantly. We're now getting calls maybe every once in a while, not so much about COVID, but more about when they can be released from home isolation, or just another random question or two, but most of the calls are minimal. We also continue to monitor and respond to nursing home reports of positive cases and following up on assisted living facilities. Then we also continue our routine services. Of course, they're reduced, what we're doing with our routine services. So within our STD program, we're only managing or responding to urgent calls, people with symptoms or contacts, and we will assist them in the best way that we can. And then we're also continuing to manage our latent tuberculosis cases, as well as our active TB cases. And then our grant-funded programs like the IAP or Immunization Action Plan and the WIC programs are working remotely and continuing to, as the WIC is continuing to provide full services to their participants, IAP continues to manage their data and reach out to their providers in the community. And any of the grant-funded programs that are not able to be in operation at this time, their staff have been reassigned to other activities within the health department to help out with our efforts. And I believe that's it for my update. Thank you.
Thank you so much, Darlene. Does anybody have any questions for Darlene?
Hi, Darlene. This is Ken Lalim. Where are you on testing? Testing seems to be the new buzz, and from what we're seeing with percentages of positive test results, we've got a couple of Department of Health and our organization that's statewide are actually going to community health centers around the state and popping up the Abbott testing capability, where it's a rapid test, rapid result. And we're finding that the percentage of positives is enormous. And if we see that to continue, I mean, it almost leads to, just mass testing. And where would we be? Would we be part of that as a department? What role would we play if there was all of a sudden a outcry from Hartford that said, everybody, you got to test everybody? I'm exaggerating, I realize, but so I just wondered where we are within that testing capability and opportunity.
Right. At this time, I know that within the health department staff, of course, we are under-resourced to provide that. We could probably help facilitate providers, locations, and the setup of testing if it came to that. I know that's not something that we've discussed at length at this point, but I do believe it would be a discussion that the senior management team and the health director would have to have in conjunction with DPH.
Thank you, Darlene. And Ken, just to add to that, I know the state health department, there's multiple parts to getting to the reopening phase. And one of the big parts is increasing the testing capacity. And the other is to increase the capacity to do the contact tracing. So from what I've heard so far from the state health department, I think they're really looking for us to be the contact tracers, to bulk that up, to, once the cases go down, to really be able to do more in-depth contact tracing. They've looked at new software systems to be able for us to talk across jurisdictions. So I think the state health department sees us in the contact tracing role rather than the testing, but they, that ask may come, we're not sure.
Thank you.
Mhm. Anybody else have any questions for Darlene?
Terry Quell, good morning, everybody. Just wondering, I know that there's been a lot of oversight with the nursing homes, and I'm wondering, you did mention assisted living. I know most of the assisted living, or a good number of them, are elderly folks as well who are vulnerable. And I'm wondering what exactly is being done to keep an eye out for those folks?
That's been a bit of a challenge for us. We do maintain contact with them to be informed of the positives that they have, the measures that they've put in place to address this, and we've provided guidance as best we can. We've also attempted to work with the Department of Public Health to address some of the concerns around the assisted living population. And so that's where we are at this point. And we've also supported them with providing them PPE. So we're trying to find out what their needs are and trying to address those as well.
Great, thank you.
You're welcome.
Yeah, and if I can add to that, Terry, just so you know, there's a lot of work specifically around the administration. So that's where I kind of live, work, and play with the administration of the nursing homes. And one of the challenges, at least in Lower Fairfield County, we'll hear about the State Department opened up these, decompression or other sites for those. And unfortunately, that's not happening in Lower Fairfield County. You may have heard in the press that there is talks around opening up Silver Hill, specifically for this reason. However, while the facility is available, and we're actually working with our state representative, Lucy Dathan, she was actually on the call last week with our congregate care, nursing facilities, all those particular organizations. And her and her colleagues actually submitted a letter to the governor to really urge additional resources, again, to the Lower Fairfield County to provide the support. The issue right now is staffing. Getting that facility staffed, finding workers to make that commitment. And at this point, the workers will be drawn from the facilities who need them in their facilities right now. And I think the other piece is some of the residents are saying, I want to go back to my nursing home. And, many of the facilities are saying, we're not going to force them to go. I mean, these are their places. So there's a lot of complexities around that. But I think, there are calls, and we have, even from the call last week, we're still hopeful that the state and the resources are here to open up Silver Hill, because the nursing facilities have indicated they will still need this service for those who will and can, or we're hearing about the surge. We don't know as long as people are practicing our safety precautions. So that's where we are on a kind of a macro level with the facility, trying to get this facility open at Silver Hill.
David Reed, can you hear me? Can you all hear me or no?
I can hear you.
Okay. I just want to comment on the nursing homes because I talked with Russ Barksdale, the Waveney CEO who was in charge of running the Silver Hill facility, and they've been inspected and discussed, and they are waiting for approval. They've been told they're approved, but they actually haven't gotten it. I believe they have some staff. I think they feel they could get it. The state just hasn't followed through on that. The other thing I'd like to comment on is testing. We all know we're resource constrained, although more tests are coming out, particularly for the Abbott labs, which is very fast and efficient. But I think there's a lot of focus on how to use them. And since somewhere around 20% of the deaths are in seniors and nursing homes, that's the focus. And there's a lot of looking at, should we test all the residents, all the staff in a nursing home and sort things out from there. So I think you're going to see a focus on the most vulnerable and trying to figure out with testing how to protect them and move it out as we get more tests. But that's what's going on at the present time.
Thank you, Dr. Reed. Okay, let's move on to Glenn Iannacone, our Public Health Preparedness Coordinator.
Good morning, everybody. 4 years ago, Donna Schlegel and I developed the emergency response team because we had a need for volunteers that I saw when I came on board here. We currently have 143 trained individuals, volunteers. We have 94 of them are actually active. So if you hear me refer to the ERT, it's the emergency response team. For the last 5 weeks, more than 40 driver delivery teams have been making multiple trips each weekday, bringing food to people in need throughout the NAWC community. Monday through Friday, teams are packing food in person-to-person NAWC pantry since March 30th. The non-perishable food is packed in preparation of the following day's program. The shifts and procedures have been modified to allow for more generous workspace inside the pantry. Half a dozen ongoing reassurance warming calls that you heard, I think Lamont referred to, are being made periodically to isolated individuals and others in need. More requests for contact calls are now being directed to us from the NAWC Community Health Center staff. Hundreds of homemade masks have been stitched and distributed by our volunteers. To date, the masks have been issued to ERT members for their safety while working. All team members are wearing masks and gloves while packing and delivering food. In the last 2 weeks, masks has also been supplied to the Office of Emergency Management for distribution to City Hall workers and the Transit Department. We were asked and brought masks to residents of NAWC independent living facilities. We have since made calls to other similar senior facilities asking about residents who would benefit from washable, reusable masks. Masks will next be supplied to NAWC family child care programs that are open and operating for essential workers. ERT members are assisting the Clinical Services Division of the Health Department with contact tracing in English and Spanish. ERT translators have supported educational messaging in multiple languages. And ERT members are supporting their community and service organizations, Senior Services Coordinating Council, NAWC Community Health Center, Person-to-Person, NAWC Housing Authority, and projects pending with Bridgeport Rescue Mission, Open Door Shelter, and the Collaborative Food Assistance Delivery Program. And Don has been managing volunteer efforts of the ERT, as well as spontaneous volunteers recruited to help with the expansion of programs. There's been over 70 spontaneous volunteers gathered via volunteer assistance survey on the city's website. As far as distribution of PPE, I've been in constant contact with long-term care facilities and home health care companies And to this point, I've distributed 122 face shields, 210 KN95 masks, 1,550 procedure masks, and 1,350 gloves. We yesterday took a delivery of more of a pushback from the federal government, from the state, for PPEs. I have to go through them and inventory them and place them in our storage container down in the basement. And also, I'm just started working on developing a plan for a drive-through pod for if we have to do vaccinations. You know, hopefully we'll have enough product to do multiple vaccinations down at the beach, and I'm working on that plan right now. I think that's it. Any questions?
Thank you, Glenn. This is Deanna. It's incredible hearing all that the emergency response team has done, all they've contributed. You know, I said, you know, every time we had a new class graduating, I said, I can't imagine getting through a public health emergency without them. And they've really stepped up and they've done so much. And you and Donna have done such a great job coordinating all of that work. So thank you.
Thank you.
Does anybody have any questions for Glenn?
Glad you're optimistic about setting up vaccination clinics. We hope to get a vaccine soon.
Yeah.
Yeah.
So next up is Teresa, our health educator. Teresa Argandesi.
Good morning, everybody. This is Teresa Argandesi, the health educator. As Deanna said, it's great to see everybody. Just a quick summary of what I've been working on the past month or so. Our role in health education has been primarily twofold. One is coordinating and pushing out messaging, reliable science-based information. And the second is to support the community services work that Lamont talked about. So in terms of information, it feels like a million years ago, but our first information push, you know, as you know, probably in mid-February was general information and some basic prevention steps. And as you know, those prevention steps have evolved significantly. So we continue to keep those up to date as best we can, you know, moving from hand washing and infection protection all the way up to making masks at home. Then, you know, somewhere in mid-March, we started to work on information around what to do if you feel sick. So once we started seeing increased numbers of cases, providing people with information about testing facilities that were available, the difference between self-isolation, self-quarantine, and social distancing or physical distancing. So creating some materials around that. Again, as things change and different categories shifted based on the recommendations from the CDC, we tried to adjust as we went. And now, you know, happily, we have also included some content on the website around recovery. So what does recovery look like, or what does it mean? In most cases, the best we can do is the CDC's criteria for release from self-isolation, which you know, is a slightly different thing than recovery. But we also have included some information from Nuvance Health about plasma donation for those folks who have confirmed COVID cases and have meet the eligibility criteria for plasma donation. And then also some information about antibody testing, which we are looking closely at. There's a lot of buzz around it. People are very anxious to have access to antibody tests, but we're providing material or information to let people know that, you know, we're kind of urging caution when it comes to these tests right now for individuals, although population level data around antibodies can be really helpful. Most individuals that are inquiring about antibody testing would like, you know, to go in and get a test and find out if they had been exposed to COVID. And we don't feel like the state has urged caution in that because there's so many different kinds of tests out there that have not yet been market approved. So, and then of course we have a lot of information on the website about taking care of yourself and others. So referring to some of the information that Lamont has talked about, food access services, mental health and support services, trying to, you know, connect people to the community resources that are out there at the local and the state level. And then the next work we're looking at in information is not just only keeping those things up to date that we've already put forth, but also looking at collecting best practices and guidelines and frameworks for reopening. So when and at what rate that happens is is going to vary probably by sector or however the governor's reopening plan and the mayor's plan move forward. But we know that different community agencies are going to look to us for protocols and guidance around, how to open safely, that they can protect their employees and their clients. And so we're trying to figure out, where that best practice information is coming from and how we can bring it together and push it out to the community. And then in terms of supporting community services, I think you've all heard a little bit about some of the work that we're doing in that area around food access for the last couple of years or so. And then also the health enhancement communities work looking at social determinants of health. And so now we're in the process of repurposing some of our grant funded programming to shift away from the original food access work we had been doing to more of this emergency response, supporting the pantries, bringing the pantries together, making sure the public is aware of the resources that are out there, and then helping Donna's amazing work in recruiting and coordinating those spontaneous volunteers to help in that effort as well. And I think that's it from health education.
Thank you, Teresa. Does anybody have any questions for Teresa?
Teresa, yeah, Ken Lalame here. I see from an education point of view, with the large populations that we have in certain communities in the city that require a different way of communicating. I see education as being so important for where we're going to be heading. If and I still think testing is going to be just brought on us whether we like it or not. And you're right, people need to be educated as to when do I seek care, and when do I come? Otherwise, we're just going to get overrun. The community health center is going to be able to handle it. Physician offices have been pared down with staff, and trying to ramp all that back up at the same time is going to be tough. So I think there's going to need educational push in the city so that our residents access the system in the most efficient way that we can help them. Because otherwise, I think it's just going to be, these calls are going to be much different going forward. So, but just something to I think about. It's happening in other communities in the state, and it's people are getting a little worried that that surge is going to really huge. So.
Yeah,
Just
no,
a thought.
absolutely. And we're trying to think of, right now we're in a phase, I'm in a phase of trying to make sure that the information is all accurate as it changes over time, trying to listen to all the calls and read all the information and make sure, because it does shift. And so, which is a challenge from a communication standpoint, not just to be accurate, but then to be credible if some of the recommendations change over time. But what I'd also love to be able to do is create more materials, or at least find existing materials that include fewer words and more pictures, as well as video demonstrations and things like that that don't require reading. So we've been so lucky to have the ERT members and staff members and community partners helping with translation. But at some point, I'd love to see the CDC put out, or other agencies put out, more infographics and pictorial representation, so that the information can be really straightforward and really clear. I think that's something that we're as a nation, and I guess as an international community, are struggling with this, because we're just trying to get up to date on things. But that's my hope as we start to get to the end of our first peak, and hopefully our last peak, that we can start to focus on creating or sharing materials that do a better job of clarity and health literacy.
And talking about the things change, I think it really, I don't even think it's even days anymore. It changes by the end of the day. It'll change already. It's a tough role. So thank you.
Guidance changes literally weekly. You do have to have, without a scorecard, you don't know what it is. It's really challenging. But you told them last week it has to change.
Next, we have Tom Closter, our Director of Environmental Services.
Good morning, everyone. We've actually had two phases to our role in this. The first phase would be our notification phase, when the governor and the mayor came down with their guidelines for implementation. We had to notify all of our body care facilities, over 150 body care and beauty salons. We contacted all of our public pools to make sure they were closed. We contacted our daycares and discussed the guidelines with them about how they can stay open. Our licensing for our massage establishments, tanning, body care, pools, actually, they all expire this Thursday. So we've been in contact with all those facilities as far as holding off for now in the renewals. We don't even know the status of the public pools. We don't know if they're going to be able to open. So we're going to try to figure that out in the coming weeks. The second phase to this for us has been enforcement. After the body care facilities have been closed, now the technicians, barbers want to work out of their homes. So we've been following up on complaints regarding that. We've inspected our 10 largest grocery stores multiple occasions. We're following up on the guidelines for social distancing, shields, one family member shopping at a time, one-way aisles, half capacity. We're making sure that the stores are being bleached and sprayed with sanitizer every evening. All the shopping carts are washed with a hospital-grade disinfectant. The next thing that we've been doing is taking the calls about positive cases for food workers. So we've been working with Darlene as far as making sure those people have been excluded, and also making sure the any contacts for those positive workers have been excluded from the facilities. And I will mention the complaints that have been coming in for positive cases has not only been the food establishments, it's been businesses throughout Norwalk that we followed up on. Now the phase we're in is kind of gloves and masks. So all the people driving through, looking for coffee in the morning, and the calls are coming into us. They're not wearing gloves and they're not wearing masks. So we're trying to follow up on that. Our sanitarians have been actively working on all their septic cases throughout this. Mainly the work is outside. And our housing inspectors have been performing inspections on vacant apartments and a lot of exterior complaints regarding yard and garbage issues. We're following up on complaints like, I live in a building with a positive case and there's a common HVAC system, and how's that going to affect me? But we've stayed pretty busy throughout these last month and a half. That's my update.
Thank you so much, Tom. Does anybody have any questions for Tom Closter? Thank you, Tom. Pat, can you give an update on what you've been doing, with keeping us going? And
Thank you. Good morning. I'm Pat DePietro. I'm the business manager / lab tech. So as far as the building management, business management side goes, that goes on as usual. So paying the bills and, bringing in revenue, making deposits, all of that continues, whether we have COVID or not. But during the COVID crisis, when everyone else is getting extensions on paying taxes and extensions on paying bills, the state has required that all grant financial reporting and the progress reporting is done on time. So there's been no extensions, no leeway on those reportings. So I've been busy doing all of those. Some are monthly, some are triannual, some are quarterly. So it's all still happening, just like there was no crisis. So as far as the crisis goes, there's going to be, I've been keeping track of all expenses related to the COVID-19, any sanitizers and laptops and cell phones, things that we needed to buy that gave us continuity of services will be submitted for reimbursement. So the first quarter, there's the crisis funding from the CDC, which is being administered through the state, is they're looking for reporting as well. So the January to March period was due this month, week or so ago. And so that I took care of that. There'll be additional funding reimbursement that we can submit for city workers, like for overtime or other expenses that are not going to be funded through that CDC money, through the crisis funding. And so I'm keeping track of all of that. So I think that is it for my role. I'm very busy.
Yes, she is. Yes.
Yeah, because like I said, the normal routine stuff is still happening at its regular pace.
Yeah. I can't say how grateful I am for everyone on this team and for Pat for keeping all that straight, and for, you know, for everything. As you know, our roles have had to focus really on COVID, and you've been able to do COVID related and also, you know, do all the important reporting and capturing all that information. So thank you so much, Pat.
Oh, you're welcome. Thank you.
Dr. Reed, do you have anything you want to add? I know you've been speaking. You're on mute right now.
Sorry, it automatically mutes. Yeah, just one other thing, and that is that we're all optimistic that we're on the downtrend of this. All I can say is in Stanford, the caseload is near its highest. The hospital vents are down and others a little bit, but I think that's maybe to be expected. Fairfield County's been the hardest hit. If you look at the state, it's Fairfield County and New Haven, and the rest of the state is much less so. So hopefully the trend will be more prominent. I think it's flattened, but it hasn't gone down yet.
Thank you, Dr. Reed. Does anybody have any other questions or comments related to COVID-19 before I ask Megan to talk about reaccreditation?
It's kind of lame. Quick question for Pat. Are you doing any testing, Pat, at all, lab?
No, we thought we were going to get involved, but we thought we might get some kits, but it didn't. I don't know what the issue is, but there's no plans to do any testing.
Okay, thanks.
Just to add to what Pat was saying, originally the state was, you know, if you're like in a long-term care facility, you can contact the state directly, the state public health lab, to get testing kits. So you're able to then submit them back to the state lab for the actual testing. And they were thinking about how local health departments could support that effort by getting test kits available at the local level. So if there's an emerging issue, we can get the kit right out to them. But they didn't have the capacity to have them available for every local health department. And so instead they're asking those long-term care facilities to contact the state lab directly if they have a need to do testing.
Yeah, we're actually working with the state at community health centers, but their next view is to take this mobile van that we're using with the Abbott technology embedded in it, taking it on the road and taking it to nursing homes, because that's where obviously you want to separate the, you know, those that are positive from those that are not in a nursing home, because it's been such a high hit rate on the mortality. So
that sounds like it could be a very promising model.
Yeah. We're trying. Thanks.
Yep. Any other questions, comments? All right, Megan DeMeglio, our project coordinator, just gonna talk about reaccreditation.
Good morning, everybody. This is Megan DeMeglio. I'm the project coordinator, as well as our accreditation coordinator. So like mentioned before, we're going through our reaccreditation process. So I'm just going to give you guys a quick update on our timeline and how it relates to COVID and whatnot. So if you remember, in October of 2019, we submitted all of our documents for reaccreditation. I then, right before I went out on leave, Deanna and myself reached out to FAB to let them know that I would be out on leave. And during that time, they were going to work on getting our site team together. And so they did send us a list of site team potential members to make sure we didn't know anybody. And then we were told that we would get a site team assigned to us and they would review our documents. And so the site team wasn't available. They didn't have enough site team members available at the time, so it kind of got pushed back. When I got back from leave, it was a week before everything with COVID happened. So FAB is on a holding pattern right now with a lot of their site teams because, you know, it's a voluntary program as being a site visitor. So, you know, just like as we're, you know, in the midst of this, so are the site team visitors. So right now they're holding off. They did, when I did reach out to them in early March, they said that we had a tentative site team, so they should be probably reviewing, hopefully to start in June, and we would have some type of a site visit in the fall, potentially. That was prior to, you know, everything really, you know, happening. So they said that they'll reevaluate and let the health departments know where we stand. So we haven't heard any real updates. So right now it looks like somewhere in mid-June, and then a site visit potentially in the fall. So I'm sure in the months to come, we'll get more clarity on where we stand. And so just for you guys to remember, the site team has 12 weeks to review our documents. Once they review our documents, we'll have 6 weeks then to respond to them. And then a site visit would be usually 4 weeks after that. And so right now, like Darlene mentioned, I've been helping out with contact tracing in the meantime, as well as IT work and just staying up to date on reaccreditation and what's going on. Any questions?
Thank you, Megan. So I just wanted to like talk about personnel quickly and just like current health department operations. I know many people have already talked about current operations, but we did have Corey Bria, who was our part-time lab tech working with Pat in the lab. She left to accept a full-time position elsewhere. We're really excited and happy for her that she was able to find full-time employment. We're happy we were able to work with her for, you know, about a year, I'd say. Helping support the lab. And we also have extended an offer to a receptionist, a new bilingual receptionist, and she has accepted. So we're hoping that she will start soon. But so related to all of this, while other businesses eventually are going to be reopening, and we have to think about internally, you know, and this is what the city's thinking about is, you know, what do operations look like moving forward? And for us in particular, we're still going to be having to focus on COVID-19. We're still going to have to be checking really closely on results as people get tested, following up with positives, making sure they isolate and doing that in-depth, you know, continuing to support. So we have to think about, you know, what services are we going to be able to continue doing, you know, in this new phase as we move forward. So something that we're thinking about, wanted you to be aware of that and more to come on that. But, you know, we're going to have to, you know, we have our limited resources and we're going to have to be able to focus those resources on what's most appropriate moving forward. Does anybody have any comments, questions before we wrap up?
Terry Quell, just a comment, big thanks to all the staff who are doing a terrific job. But I do want to just remember back to a couple of years ago when Ken Lalim started a discussion about the Board of Health, and folks don't know what boards of health do and how do we educate the public about that. And all I can say is we don't have to educate them anymore. They know what we do now. So it's interesting times.
Thank you, Terry.
Yeah, it's Ken Lalim. My additional comment on that, I think it continues to be an opportunity to continue to do that and play that role, because I think it's going to become more prominent, and many of the things that we're doing may stick around for a long time. So all these things that we were hoping people take away from what is public health, they're starting to realize that public health is distancing, public health is masks, public health is some of these things that may need to be amongst us all for a lengthy period of time. I'm watching what goes around the state, and there's positive rates that are coming out of some of the testing that are alarming. And I think that we're going to need to continue to educate the population so that we don't become a city that has continued problems, that we're trying to work them down through education. So I think it continues to be a real opportunity to continue to educate the citizens of the state and the town. So thank you for all you do. You guys are doing a great job.
Thank you. Anything else? Well, thank you, everyone. I just feel so grateful to have such an amazing team, to have such an amazing board. I just feel so fortunate. I love Norwalk. I love you guys. Thank you for all that you're doing. What a great team we have here.
Thank you, Deanna.
All
Very
right,
much.
everyone.
Thanks, everybody.
Thanks, everyone.
Thank you.